Thank you for joining me. I'm going to spend a short time today talking to you about the Advancing Dental Care Programme, known as ADC, which was set up by HEE in 2018 and will run through until 2021. The purpose of the programme is to look at the workforce need and the population need to make certain that going into the future we actually have the right workforce in the right place, doing the right thing for the right people. And we're going to look at all the elements of the workforce programme and the training programmes that go with it. Initially, we started by carrying out a review process and doing a consultation to find out what other people's views were. That resulted in a report in June 2018, which was published with 21 recommendations. As a result of those recommendations, we are now moving forward to look at how we can implement some or all of those recommendations in a way that does develop the workforce better. Part of that process is to tie in with the work that's being done now, first of all on the NHS long-term plan, but following that the NHS People Plan. And we have been very heavily involved in the work developing the interim People Plan. That's identified three particular areas which matter to dentistry. One is the contract reform programme, which is currently being undertaken by the Department of Health. One is the need for more digital support for the NHS and dentistry. And the third strand, which obviously the part I'm interested in particularly, is the advancing dental care and the workforce, and that will be the main plank of developing that part of the People Plan going forward. So as we move into that way, we have been doing a lot of work in the last few months in gathering particularly workforce intelligence. There wasn't a lot of intelligence out there in the past, and we were perhaps criticised for that slightly when we produced the report. We've now gathered an awful lot more data with the help of lots of colleagues and lots of people who are involved and will continue to be involved, stakeholders and partners, in developing an evidence base that will support a new workforce model. We're using that information, and we're going to also be doing some work to develop with that information some projected pathways of how people might live, work and train, of how people might train across the dental sector, and this includes dental care professionals as well as dentists, and how we might make career structures which people want to be within in the NHS, so they remain in the NHS, and we develop pathways that allow people to develop their own skills and in their own way, in their own time, but still of course to meet the needs of the workforce, the patients and also the service. So we've developed a thing called Achoo Map, for want of a better way of describing it, and it is a very complicated map of lots and lots of pathways. And it doesn't follow that all those pathways, or indeed any of those pathways, are the correct way forward, and there may well not be one pathway anyway. In fact, we may have to have a very flexible pathway model. We're going to share that with our stakeholders, starting with a large event in the 22nd of October, which has already been set up. And the launch of that will also launch the Achoo Map and enjoy more broad-based engagement with our stakeholders. So following on that event, we will have local events led by the postgraduate dental deans in England going forward, and we will engage as broadly as possible. We're also going to talk to patients. We're going to find out what the patients' perceptions of dental care is and what they think their needs are. So we're going to understand that element as well. We also need to understand the work on what the oral health of the population is, so we'll work with Public Health England on that. And as we develop all these various models, we hope by the end of the engagement period to have at least a pretty clear idea of the sort of workforce pathways that we need going forward. So those events will start in October, as I said, and we're hoping to have something to share with you in more detail at the start of the new year. Once we've got that, we are in a position to start to move forward, and we hope to then build a number of pilot areas, both for dentists and DCPs across the country, which will allow us to test and make sure that we have the right models. That doesn't mean to say we're going to throw out all the old models. Some of the old models are exceptionally good, and we won't want to lose those. But we do need to create a much more flexible, part-time modelling of the way careers are developed, particularly for our younger colleagues, but not exclusively so. Once we have that understanding of what the general direction of travel is, then it is our intention to develop a workforce able to deliver NHS dental care in the right place to the right people, as we started at the beginning, and that workforce will be motivated to remain within the health service.